Right. Hello there and welcome. Today, we're going to get right under the skin of a topic that affects absolutely millions of us, but is often a bit misunderstood: fungal infections. There's so much more than just a simple itch or a rash, and honestly, understanding what they are is the very first step to getting them sorted. So let me start by asking you a question. What do you reckon ringworm and athlete's foot have in common? I mean, they sound like they're from completely different worlds, don't they? Well, the surprising answer is they're both incredibly common types of fungal infection caused by these tiny microscopic organisms that are pretty much all around us and sometimes living on us. All right, so to really get our heads around this, we're going to start with the absolute basics. In this first part, we'll break down the different categories of fungal skin infections. Think of it as mapping out the territory so we know what we're dealing with. Broadly speaking, when we're talking about fungal skin infections, they basically fall into three main camps. And here they are. First, you've got your superficial infections. These just affect the outer layers of the skin, and they are by far the most common ones you'll come across. Then you have deep infections, which, as the name suggests, go a bit further in. And finally, systemic infections, which can actually spread throughout the body. Now, for our purposes today, we're really going to focus on the superficial ones, because they're the ones most of us are likely to encounter. And when you look at those superficial infections, it turns out there are two main groups of culprits causing most of the trouble: a group called dermatophytes and a type of yeast called candida. We're going to get properly introduced to both of them, starting with the dermatophytes. Okay, so let's dive into our first major group, dermatophytes. You've almost certainly heard of the trouble they cause, because these are the fungi responsible for what we all call ringworm, or if you want to use the proper clinical term, tinea. So what are they exactly? Well, you can think of them as incredibly picky eaters. They only infect and munch on one specific thing: that tough, protective protein called keratin. And keratin is what makes up our skin, our hair, and our nails. So for these fungi, bits of our body are literally their dinner. And inside this big dermatophyte group, there are three main scientific families, or genera, that are behind most of these infections: Microsporum, Trichophyton, and Epidermophyton. Look, you don't need to remember those names, but it's just helpful to know that these are the three main players a doctor would be looking out for. Right, so how do you actually catch them? Well, there are three main routes. The most common is just person-to-person contact, which has the fancy name anthropophilic, anthro meaning human. You can also get them from animals like your cat or dog. That's called zoophilic, zoo for animal. And, a bit less common, you can even pick them up straight from the soil, which is called geophilic, geo for earth. Now, a classic example, one that you've probably heard of, is Tinea capitis. That's just ringworm of the scalp. It's especially common among school children, and it gives us a brilliant way to see exactly how these fungi go about attacking our hair. And they have two different methods of attack. With an ectothrax infection, the fungus actually grows on the outside of the hair shaft, and it destroys that protective outer layer. Think of it like a pest living on the bark of a tree. But with an endothrax infection, the fungus gets right inside the hair shaft itself, sort of like a pest that's burrowed deep into the wood. And why does this even matter? Well, it's absolutely crucial for treatment, because an infection that's burrowed deep inside a hair is much, much harder to get to with a simple cream. All right, so that's the dermaphytes covered. Let's move on and meet our second big player, Candida. This is a type of yeast, and it causes a condition we call candidiasis, and it behaves just a little bit differently from those ringworm fungi. Now, Candida can pop up in all sorts of places. For instance, there's chronic paronychia, which is an infection around the fingernails. You see this a lot in people whose hands are constantly wet. Think of bartenders, cleaners, or maybe parents with young kids. Another one, erosio interdigitalis, affects the webs between your fingers. And then, in more serious cases, there's a persistent infection called chronic mucocutaneous candidiasis, which usually affects people who have a compromised immune system. Okay, so we've met our culprits. Now for the really important bit. How do doctors actually figure out what's going on, and what on earth can be done about it? Let's take a look at the action plan for diagnosis and treatment. Well, it usually kicks off with the doctor just having a good look at the rash or the affected area. But to be certain, they might take a little skin scraping or a swab to look for the fungus directly under a microscope. Now, if it's a candida infection that keeps coming back, they might suggest a blood sugar test, because sometimes high blood sugar can fuel yeast growth. And in some cases, they'll even try to grow the fungus in a lab from that sample. That's called a culture, just to identify the exact culprit. One of the biggest challenges with all of this is that fungal infections can be brilliant mimics. This whole process is called a differential diagnosis. It's about telling one condition apart from another that looks really similar. For example, ringworm on the scalp can look an awful lot like simple dandruff, psoriasis, or even some types of hair loss. And this is exactly why just guessing what it is can be a bad idea, and why getting a proper diagnosis from a professional is so important.
So once it's diagnosed, the treatment strategy is usually a three-pronged attack. First up is prevention. Simple things, good hygiene, that's key. Then you have topical agents. These are the creams and ointments you put directly onto the skin. And finally, for the really stubborn or widespread infections, doctors turn to systemic agents. These are the medicines you actually take by mouth.
But when it comes to those oral medicines, it is definitely not a one-size-fits-all situation. For example, a drug like griseofulvin works to treat against dermatophytes, but not candida, and it can cause things like an upset stomach. Then you've got the imidazola drugs, which work on both types of fungi, but they carry a risk of more serious side effects. This is why a doctor has to be a bit of a detective, carefully matching the right drug to the right fungus to make sure the treatment is both effective and safe. And this is a really, really important point to take away. This quote basically says that while creams and lotions can be great for a simple fungal infection on your skin's surface, they often just can't get deep enough to treat infections that are in the hair or in the nails. Those nearly always need systemic treatment, the pills we were just talking about, to really get rid of them for good.
So that pretty much brings us to the end. We've seen that fungi are just a constant part of the world around us. And that really leaves us with a big question, doesn't it? Given that we are literally surrounded by these organisms, is focusing on prevention, just good, solid personal hygiene, truly our best and most powerful line of defense? It's definitely something worth thinking about. Thanks for tuning in.